You're watching the Wellness Hour, leader in medical news and information. I'm Randy Hours. Today's topic, no more dentures. Get a fixed set of teeth or a set of teeth that snap in, snap out in just a few appointments with mini or small diameter dental implants. With us, we have an expert on the topic, Dr. Lasorsa. Dr. Lasorsa, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, and I know you brought models and lots of photos, who's the typical patient? And what are the different procedures you do? I guess your wife is also a dentist?
At our office in Citrus Hills, we have my wife, Dr. Lexa Davila, and our associate, Dr. Sunny Van Hoos, and we do everything a general dentist can do. We do cosmetics, we do crowns, bridges, partials, dentures. We have our own in-house denture lab, so we do all our dentures and all our repairs and all our partials right there in-house. And of course, I do root canals, which everybody loves to hear. I do extractions.
Do you like to do those, by the way?
I do. I love doing root canals. But, I don't get the response doing a root canal for somebody that I do getting when I do a case of mini implants for somebody.
Like somebody to snap in their denture, snap
I mean, somebody may be happy they were in pain with that tooth before, but it's not the uplifting experience after I complete a case of mini dental implants.
Giving them their teeth back.
Exactly. Giving them their bite and their smile back.
Is that right? So, now, a little bit about the typical patient that's coming in for the denture wear.
Okay. Well, in our population, generally we have a lot of retired people, a lot of older people that are missing either a few teeth or maybe all of their teeth, and they've gone for years for being embarrassed about their missing teeth or afraid of the cost or afraid of pain to do something about it. So they come in, I mean, maybe they just need a reline on their denture, but they don't know all their options that we can restore all that with mini dental implants or conventional dental implants.
So the denture wearers, you believe in that they should be secured with some mini implants or dental implants to snap in, snap out.
Yes.
No more adhesive, things like that.
No more adhesive, no more getting food stuck under them, no more worrying what you're going to order at a restaurant, whether you can eat it or not, no more worrying if you're laughing or talking or smiling if they're going to come out. You don't have to be self-conscious about that anymore. We can snap them in. They feel like your normal bite. You can eat and chew and smile as much as you want.
So how old are how old can you be to take advantage of
any age? There's no age. Probably the minimum I would do is maybe a young person that's missing their lateral incisors, maybe 17 or 18. But that's not my typical patient. My typical patient is older, retired, maybe their 60s, 70s, 80s, even their 90s.
Now this is interesting. So, or at least to me it is. Your wife does a lot of dentures.
Yes.
And she approached you, or you're talking, I guess, and she says that some people are, no matter what you do for them, when you make them a denture, they're miserable.
She asked me for help. She said, I can't, because I don't make the dentures myself. She said, I can't satisfy these people, no matter how well they're made, no matter how well they're processed. They're frustrated because they just don't work that well.
Okay.
So she asked me if I could, since I do a lot of surgery, if I could start doing these mini implants for the denture wearers. So I took several courses, and I started doing some mini implants a few years ago. And since then, I've done hundreds.
And we're specifically talking about you did mini implants for what? For dentures?
For denture wearers, yes, correct. So I've done hundreds of them by now, and they work very well.
What has happened now with these denture wearers that you didn't anticipate?
I didn't anticipate the response I was going to get back once the case was completed. I'm used to seeing people in pain. They need a root canal and an extraction. Okay, which one hurts? I'll take care of it. These people weren't in physical pain. They were in pain that they were frustrated wearing their denture. So once the case was completed, I didn't anticipate the response of how happy they were, how I gave them their life back.
Is that right? Are they ever without teeth when you do the procedure? That means, are they ever left without teeth, is what I meant to say.
Are they ever left?
That means in between, while you put in the mini dental implants, are they healing without teeth in their mouth?
No. With the mini implants, no. They get their teeth back the same day.
Is that right?
Yes.
So when you say, we said this on the phone, I'll put you on the spot here, same day. I mean, they could go in, they're just wearing a denture. They can leave with the dental implants and a set of teeth snapped on those
same day, within a couple hours at the most.
Is that right?
That's right.
But it's painful.
It's not.
It's got to be painful.
No, it's not painful. That's what people think. That's why there's a lot of denture wearers out there, because they anticipate pain, they anticipate cost, they anticipate the trauma that they already went through when they had teeth. These are not painful. Sure, they're going to be sore for a day or two. I mean, with any procedure you're going to do, I warn them they may be sore for a couple days, but it's usually not. I usually see them for a follow-up, and they have no problems.
So what's changed in the world of, and I guess we should mention, so we're talking about an affordable mini dental implants, small diameter implants, as you call them, that they're not to be confused with traditional dental implants, but you say they're a lot less expensive.
Well, not everybody has $30,000, $40,000, $50,000 to spend on their teeth. Mini dental implants offers a fixed set of teeth with a lot less trauma, a lot less steps, a lot less surgery for much less, for maybe a fraction of that cost.
For the denture wearers out there, and you say there's tens of thousands that are upper lower denture, and it doesn't have to be that way. They can be secured with these mini implants. If it's so good, why isn't everybody doing it? Because logically it makes sense to secure them with something. What's the hesitation?
Number one is cost. Okay, they think they have a friend or relative that spent $30,000, $40,000, $50,000 to get implants and new teeth, whereas with the mini implant option, it's a fraction of the cost. Okay, so cost isn't as much of an option, as much of a.
And you finance these people as well.
Absolutely, we do.
Okay.
We have finance options. Number two is they think they're too old. Like, well, if I have a lot of people that said, well, if it were 10 years ago, I would do something like this. I'm like, if it's 10 years ago, what are you going to say for the next 10 years? What are you going to say tomorrow? Okay. You don't want to eat and chew now for the next 10 years? You want to wait 10 years from now and say, I should have done it 10 years ago again?
All right.
Okay.
Well, how old can you be to do this?
There's no age that
I mean, 75?
Absolutely.
Because that's young, especially in Florida. I mean,
hey, I place implants in people in their 80s and 90s all the time.
Really?
And they're successful. Absolutely.
Successful defined by they don't fall out.
They don't fall out. They don't hurt. They're functional.
Why would somebody 80 or 90 want to do this?
Well, they want to eat and chew just like you and I do. I mean, people that are wearing dentures have a struggle that they may not want to talk about. They're loose. They're frustrated with them. They have to use some kind of glue to keep them in. They may have to try to figure out what they can eat and what they can't eat ahead of time. When they go to a restaurant, they have to look at the menu and decide, I don't know if I can eat this.
Is that right? I mean, do they tell you this?
They do tell me this.
Okay.
When they do eat something, they may have to excuse themselves and go to the restroom. They have to clean out their denture, put the glue back in there, put it back on, and then go back out to the restaurant.
So it becomes a big part of their life. For the denture wear,
yes,
to take care of the denture.
They become very self-conscious about it, yes.
Okay, so the original question was, why isn't everybody else doing it? You mentioned cost. They think it's more than it really is. Number two, they think they're too old. What about pain? I mean, it does seem painful. It's got to be painful.
It's not painful, no.
I mean, the next day it's got to be painful.
It's a little sore. I mean, we're putting something in their gum, so it's a little sore. I'm not going to say that it's pain-free, but it's a lot less than what they've already been through. I mean, people that have lost teeth, they've often reminded them of years ago when their teeth hurt. They were always a problem. They were always going to the dentist. Now that they don't have teeth, maybe they don't want to go back to the dentist because they associate that with all the pain and struggle they went through before.
It's not like that.
It's not like that at all.
Do you ever have patients that say, doctor, it didn't hurt at all?
Absolutely.
You do?
Every day.
Every day?
Every day.
They say, nothing?
Nothing. They're
so
fine.
What do you give them the next day? Like a Motrin or
I usually
know.
I do give them a prescription just in case, to make them feel better, to make me feel better, that they have something in case they do have pain. But most of the time they come in the next day and say, Doc, it's a little sore, but I could deal with it.
So when I hear same day teeth, like somebody walks in, right? I'm assuming you have imaging ahead of time, things like that. But they could go in without teeth and they could walk out with a full arch of teeth that are fixed in their mouth.
That's right.
Not an exaggeration.
No, we do it all the time.
Is that right?
They come in, we have a surgical stent that tells me where to place the implants. In the lower, we place 4 mini implants. In the upper, we place 6 mini implants. And then we have the housings to snap on. They can put a full arch of teeth in and walk out in the same day and go eat whatever they want.
Are they surprised to hear this, by the way, on the consult?
Yeah, sometimes they're in a little bit of disbelief that it can be done.
What are some other reasons why? Just fear of the dentist?
Yeah, it goes
the denture wearers?
Well, a lot of the denture wearers, they just got used to what they had. They forgot what it was like to have their own teeth. So they just get used to it. And I'd like to see more people come in and just see what their options are, that we can help them.
Now, you say you are changing people's lives.
Yes.
And, I smile when I say that because it sounds like a bit of an overstatement. But, I mean, patients tell you that you've given them, like, the mini dental implants.
Yes.
Give them a secured denture somehow. And it has a huge impact on their life. Give me an example.
Once we secure their dentures with the mini implants, they tell me that they've never been able to eat and chew like this in years.
Okay.
There's no more pain. There's no more denture adhesive. And there's no more worrying about if the denture is going to come out.
Can you make the dentures look real? I mean, as far as cosmetic?
Absolutely.
Because I feel like I could spot one walking down the street.
Now, this is Dawn.
All right.
She has been wearing dentures for years, since she was in her teens.
Mm-hmm.
And she was told she didn't have enough bone for dental implants.
Okay.
But she came in and she had suffered with pain from her teeth. She had suffered with partials. She said the partials never worked. They wore down at her other natural teeth. Eventually they had to come out and she had to go into a full denture. And she had done that for years and years and years. She came in initially to get a new denture because she didn't like the looks of her
Did she
old
go to your
denture.
wife?
She did.
Okay.
My wife constructed her a new denture. And then she saw me for a consult to see if it was possible to get some implants under her dentures.
Okay.
We were able to put 4 mini implants in her lower denture. She said they're marvelous. That that there's no more pain, there's no more discomfort, there's no more glue. She can eat whatever she wants. And she said all of her friends compliment her on the looks of her new teeth.
Let's take a look.
And this is her now.
Wow. Yeah, when you look at the before and after, she looks pretty happy here.
She looks very nice. Yeah, I mean, if you just look at the look in her eyes from the before picture to after, she just lights up when she's got her.
That is a good point. Yes. Well, she looks years younger.
She does
too.
Yeah.
And so now those teeth are hooked on by what? Like, what'd you do for her? Those are lowers?
Yes, we put 4 mini implants on the lower, and we have the housings built into the denture, and then they are secured onto the implant. So she can take them on and off. And these are made to wear most of the time. You don't have to take them out at night. You're supposed to actually leave them in.
She can wear them at night?
Yes.
That's nice.
So she doesn't have to worry about being without her denture or leaving them somewhere. They just take them out once a day to clean them and put them right back in.
And so she could eat...
corn on the cob, steak,
really?
Raw vegetables, whatever she wants.
Okay. Did they tell you their eating stories when you get this done?
Every day, yes.
Really? Like, what do they say? They come in, doctor, blah, blah, blah.
Well, I had one patient that came in the day of the surgery. He said, doctor, I've got a dinner appointment tonight. I'm planning on going out for a steak dinner. So these better work.
But not on the same night. They can't.
Yeah, so it was that night.
Oh, brother.
So I told him, okay, if these don't work, then bring me the bill, and I'll pay the bill for the steak dinner. So I saw him for a follow-up about a week later.
Okay.
And he said, Doc, there's no need for you to pick up the tab. I've eaten steak like I haven't in years.
Is that right?
That's right.
But don't you say, hey, stay on soft food, mashed potatoes or whatever just the first week?
I tell them if they want to, they can. But if they can handle it, if they don't...
Are they that strong that a person could eat the same day?
It is the next best thing to having your real teeth.
Interesting. So the bone just grabs onto these implants?
The mini implants are held in by the torque of the screw.
So it's like screwed into the bone?
Yes.
Oh, so they're ready to go right then and there.
They're immediately loaded, yes.
Is that right? And, I mean, does that worry you, though, a little bit that they're out eating steak after the procedure?
No.
Not at all?
No, that's what I want them to do. Now, I'm not offering to pay for everybody's steak dinner, but he put me up to the challenge that day, so I had to. Okay, and it worked out.
Is that right? So they called you, and that's funny. Okay, so you have more photos. For the sake of time, what are we looking at here?
Okay. This is Mildred, and Mildred was another one that suffered with a lower denture for years and years and years, and she was glad to find out that we had the options of doing the mini implants for her.
So they come in, same questions. Does it work?
Does it work? Does it hurt?
Am I too old? Do they say that? Obviously, do they ever think that?
Randy, a lot of them assume they're too old. They assume they're too old until they see me. I say, you're not too old. I do this on people that are in their 80s and 90s all the time. So there's nobody that's too old, and just about everybody is a candidate.
What were her options? Like when you explain this to them, because you have traditional dental implants, you have mini implants.
For her, traditional implants weren't even an option. She had such an atrophic mandible that
What does that mean?
that means that the bone isn't wide enough to fit a traditional implant within the bone.
Okay.
The bone won't hold it. There's not enough room for it. So mini implants were her only option, other than doing nothing and suffering like she has for years and years. Even with a new denture, it's not going to change that much. It may change the aesthetics, but it's not going to change the function.
Okay. So you gave her options, and what'd you do?
Okay, so we ended up putting 4 mini implants on her lower arch and securing her lower denture to it.
For a snap-in, snap-out.
Exactly.
Is that a full arch of teeth, right?
Full arch of teeth,
Okay.
and this is her now. And her story
That's
is...
a happy photo. This is very nice.
Her story is, I can eat, I can chew, I can eat corn on the cob, I can eat steak. I don't have to worry about putting in adhesive anymore.
What are they happiest about the most? The eating part of it, or the like the speaking or laughing or not worried?
I would say that's twofold. That's a twofold question. The function is one of them, that they can eat and chew like they haven't in years. They all say to me, this is just like having my own teeth. This is just having my old bite back again. I can eat and chew. The other thing is they say, I can smile. I'm not worried about it getting loose when I'm smiling or laughing or talking. I'm not worried about it clicking anymore, or that I have to watch what I'm going to do or what I'm going to say. Because they fit in just like natural teeth. They don't come out, and they only come out when you want them to come out.
You were saying that sometimes they're so snug, they can't even take them out.
Yeah.
You have to adjust them.
So sometimes that's a little embarrassing. They come in and they can't get them out themselves. So they come in, so we have to loosen it a little just so they can get them in and out.
Okay. So you almost laughed when you tell that story.
Mm-hmm.
So that's kind of funny to you?
Well, because I'm kind of proud of that they stay in that well.
Oh, is that right?
Well, not that I don't want them to be able to get it out, but that means we have a pretty secure fit.
Yeah. So they call you, I'm sure from home sometimes, say, I can't get these out.
Uh-huh.
I mean, do they?
Yeah, occasionally.
And you feel like, wow, that's good.
Yeah.
These mini implants are strong.
Yeah.
Okay, here's the other thing, because I'm not endorsing you, and people need to know that. What do you say to a dentist that might tell me, Randy, I don't believe in mini implants. I don't think they work. They're not tested. They're not proven as far as mini implants.
Mm-hmm.
What's your response to that?
My response is that they do work. They are tested. They are proven.
Is there any science to this?
I mean,
I'm sorry, like a published study?
There's a study of over 10 years, over 5,000 patients of mini implants, and they are as successful as conventional implants. They are a fraction of the cost. They are less trauma. In some cases, they're bloodless. I put them in. I don't even see any bleeding.
But so it works. I guess the challenge is just getting the message out there, getting people to believe it. Because you say even on the consult, even face-to-face, they're still skeptical of whether this works.
Well, it almost sounds too good to be true, that they can walk in the same day, get the implants in, and get a full arch of teeth snapped in and walk out in the same day.
Now, what about those people? And I want to make sure I asked you this question actually for myself, that if somebody's been told your teeth have to go, it's a mess, or maybe they haven't been to the dentist in 15, 20 years, they have like gum disease or really bad gums, they are not a candidate.
That's not true. No.
Okay, they are.
No.
Even if the gums are bad, though.
Well, they have a big decision to make. When you hear that for the first time, that's pretty traumatic to you to hear that you have to lose all your teeth. So, but what they don't realize is if they do have to lose their teeth, if the teeth are if there's enough periodontal disease that it's hopeless, or they can spend a lot of money trying to maintain it, and the periodontal disease is going to progress, then once we take the teeth out, the periodontal disease goes with the teeth. It doesn't stay around in the bones.
Is that right?
The gums get healthy once the teeth are out. The bone heals. Now the bone is very strong to be able to
And the
anchor.
gums get healthy again?
Exactly.
So these denture wearers, and we talked on the phone about this and a little bit in the green room, that these denture wearers went through a lot before they became denture wearers.
Yes.
And the last thing they want to do is go to the dentist. I mean,
Exactly.
nobody likes going to the dentist, right?
No.
Is that true?
No, that's not true. Some people like.
They do?
Some
I'd like
people
to
do.
meet these people. I've never met anybody.
I
go to the
always
dentist.
liked going to the dentist. That's why I became a dentist. It never bothered me.
But back to these denture wearers. So a lot of them, though, they're fear of the dentist. I mean, they went through all kind, failed root canals, you name it.
Exactly.
Last thing they want to do is go and see you.
Well, if they think back about it, they did go through a lot of pain. They did go through a lot of expense, a lot of appointments, a lot of time missed at work. So no, that's the last thing they want, is to get back into it, because they anticipate there's going to be problems, there's going to be pain, there's going to be high cost, where I can dispel those myths when they come in and they hear their options.
Now, for example, I think it was one of these ladies you told me in our green room. You said one of them didn't think they could do it because of expense and because you financed it.
Yeah, that's Mildred. She came in and she needed the financing to get the mini implants. A lot of these people are on a fixed income, or they don't make much money, or they're retired, so they need a lower cost option and they need financing. They
It's
can't
like about
pay,
what, $100 a month?
something like that. Yeah,
Yeah.
It's less than a car payment to get a new set of teeth.
Get a fixed set of teeth and chewing, and we're running out of time. You brought models, and you have a picture of a guy over there.
Yes.
So let's kind of maybe show me some whatever you have in the photos, and I want to go over the models because I want denture wearers to know what their options are.
Okay.
Because you say no more dentures.
No more traditional dentures.
Okay.
We can still go with fixed dentures. This is Tony, and Tony had dentures on the upper and the lower.
Mm-hmm.
Tony started out with 4 mini implants on the lower, and we snapped in his fixed set of teeth on the lower, and he was so happy with them, he came back less than a month later and said, I want to do the top.
Okay.
I said, okay. So we did the top. So now he has 10 mini implants, 4 on the lower, 6 on the upper, and he has a fixed arch on the top and the bottom. And there's Tony.
What a difference in this guy's
happier.
appearance.
Okay, I want you to notice something about Tony. It looks like he's forcing that smile.
Yeah, it doesn't look like a natural smile.
Well, because he's gone without teeth for so long, he's gone unhappy for so long, he doesn't remember what it's like to smile.
So they have to get used to smile.
So I had to say, Tony, you got to look happy. Take this picture. So
they're grimacing when they're smiling a little bit.
So now maybe he'll get used to it. Maybe he'll start smiling again now that he sees himself in that picture.
You have been doing dentistry for quite some time. Is this the happiest group of patients?
Absolutely.
The denture wearer that you could...
I did nothing but root canals and extractions for years and years and years. And, the people that were in a lot of pain would thank me after, oh, thank you, doc, I was in so much pain before. But I never got the responses like I get with these. These are life-changing responses that people for years, they don't have physical pain. They have pain that they were frustrated with their dentures. They were embarrassed about their missing teeth. So now I get the responses that, thank you so much for doing this. I'm so glad these options were available. And a lot of them were very happy I was coming on the show because they said, well,
Really?
Yes, because
you took these photos and told them you were going on TV?
Yes.
Okay.
I mean, some of them were like, well, okay, so my friends are going to see me. I said, yes, your friends are going to see you. But they were happy that I'm getting the word out, that there is options for these people.
They actually told you that?
She said, after you fixed my teeth, I told my daughter-in-law about it. She lives in Oklahoma, and she got the same thing done with hers. And I'm so happy you're going on this show to get the word out so that more people can take advantage of this service.
Good. Okay, the models. We're going to have to rush to the models for the sake of time. I want to make sure that the denture wearers know their options. So do you show them these models?
Yes, I do.
Okay.
The models say 1,000 words.
All right.
Here is what a lower denture looks like. Okay, This is the typical lower denture. And here's what it looks like when we're done with the mini implant surgery, if I can get this off.
Are you exaggerating a little bit? Hold that up a little bit so we can get it on the camera.
This is 4 mini implants on the lower arch. And this is what we typically see. This is a very atrophic mandible, meaning this patient has been wearing dentures for a long time, and there's not very much bone
The
here.
ridge is very thin.
Very thin, sometimes very shallow. So they're not a candidate for conventional implants. They just won't fit. But here's what we can do in one day. We can put these 4 mini implants in. Notice there's no incision. So this is what it looks like. Here's the 4 mini implants down below.
Okay.
And then what we do is we put these housings inside the denture. Can you see that?
Yeah.
Can you see that? Okay. Okay. These housings are inside the denture, and this is what snaps onto the ball of the implant.
Let's take a look. So is this the real how snug it'll be?
This is absolutely how it'll be. And
let's take a look.
You can try this on.
Very nice. Okay. So this is this is okay. So this right here snaps on a full arch of teeth.
Full arch of teeth.
Same day.
Same day.
Does it sound like that too?
It sounds like that every time.
This is accurate, and they could eat and chew whatever.
Eat and chew as soon as the anesthetic wears off. I tell them, I don't want them to go out and eat on them right away. They're still numb. They're going to chew on their lip, but after it wears off,
you claim that a guy ate a steak that same night.
That he did.
I don't mean to be so skeptical, but it does seem, look, logically, why wouldn't they all do it?
Because people don't have the message yet. They don't know that they're a candidate. They write it off that it's too expensive. I'm too old. It's going to be painful. It's not going to work. It can't be that easy.
But if they say, so if their other dentist says, the mini implant guy, the small diameter implant guy, that maybe that's an exaggeration. It's not effective. It's not safe. What What do you say?
Well, what's their definition of it's not effective if it works?
So it does work.
Of course it works. There's been studies for 10 years, 5,000 patients, that the mini implants work. They're as successful as conventional implants, 95% of the time.
So how many for fixed? Somebody wants a fixed set of teeth. How many dental implants for that?
You're saying for
mini implants.
Okay.
Like they don't want something that comes in and out, which I'm surprised to learn that with mini implants you could give somebody a fixed set.
Okay. If we're going to use mini implants for it, I'd say 8 to 10.
We're out of time. Final message though to the denture. You say there's thousands of dentures. You say no more traditional dentures. Go in. Consider mini implants.
I would say tens of thousands within an hour's drive of our office. Probably tens of thousands within a half-hour drive of our office. So I would say, come in. The consultation with me is free. Now, if we may have to take a panoramic X-ray if you don't have one, or we may have to refer you for a CT scan if it's necessary. But the consultation with me is free, and I'd like to give you your options on what we can do for you.
Okay, and if they have osteoporosis or they have those type of things, could they still be candidates?
If they have osteoporosis, or if they're on blood thinners, if they're at risk for stroke or something like that, we will work with your doctor to be able to do the surgery, to be able to do the mini implants on you.
And they're smiling again.
Absolutely.
How important is a smile?
Well,
I mean, you're a dentist. You probably think it's way up there, right?
Yeah, I think it's, that's the standard of care. They've got to walk out smiling, or I didn't do my job.
Is that right? They could eat, they could chew.
That's the goal, to get them back to eating and chewing and smiling and laughing like they used to.
Is your goal to get more of these people into with the small diameter mini implants to get a fixed set of teeth? That means the type that don't come in, come out.
That's what I'd like to do.
That's what's on the horizon. That's what everybody needs to do.
Yes.
Well, thank you for coming to the show. Very good.
All right. Thank you very much,
Very
Randy.
good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, if you only caught part of it, you can go to our website at wellnesshour.com. You can put in Florida mini dental implants, and you'll find them there. Or you could just put in Dr. Lasorsa, and he'll pop up. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.